Hi Christina, welcome to one of our first programs on the PhD YouTube program, and obviously as one of our health professionals it's fantastic to have you doing one of our first ones, and you're doing it on 5-HTP.
Yes.
Can you tell us what 5-HTP is?
5-HTP is actually called 5-hydroxytryptophan. It's an amino acid. It's the intermediate step between tryptophan and the brain chemical serotonin. So in our society there is a lot of low serotonin syndrome, and they believe that's because there's so much stress around. And low serotonin can cause a lot of different symptoms and conditions that you may have heard of. It's depression, cravings, especially for carbohydrates, fibromyalgia, also obesity, and also bulimia and things like that as well. So all of those are low serotonin syndromes.
Oh, okay, that's terrific. Has 5-HTP been studied in the treatment of depression?
Yeah, there's a lot of excellent documentation on 5-HTP being used for depression. It's actually even been documented that it can be a good alternative to antidepressants.
How does 5-HTP compare with melatonin in the treatment of insomnia?
5-HTP actually bypasses the light regulation system that controls the release of melatonin. So irrespective of how light or dark it is, the 5-HTP is going to help with the release of melatonin. So people who take the 5-HTP are actually going to get the benefits of like they're taking melatonin for sleep, but then with the added benefits of a good serotonin level.
Oh, that's great. So they don't actually need to, with 5-HTP, they don't have to have a completely black room.
No, exactly. Yeah, it's good, which most people don't.
What is the best way to take 5-HTP?
Well, there's different dosages for different conditions. So if you're taking it for depression, headaches and fibromyalgia, you want to start on a lower dose of about 50 to 100 milligrams 3 times a day. If you go okay with that, you can increase it. So it's 100 milligrams 3 times a day. Because some people, if they take too high doses, can get a little bit of nausea to start with when you're taking 5-HTP. So it's good to start lower and work your way up.
Okay.
If it's for insomnia, it's higher dose. It's 100 to 300 milligrams, and that's about 30 to 45 minutes before you go to bed at night. Again, you can start on a lower dose if you think you might be sensitive, and go to a higher dose after that after a few days. But if you're in doubt, just contact your healthcare professional. It's a good idea.
Right. Christina, you've told us about the dosages, but are there any, is it safe for long-term use?
5-HTP actually is a really safe amino acid to take, which is good, but we still always recommend that you get checkups about every 6 months with your healthcare professional just to make sure that all your blood levels are right.
Okay. What about using 5-HTP with an antidepressant drugs?
There are studies to say that theoretically you can do it.
Yeah.
However, just to be on the cautious side, it's still best to be under the care of your physician, because if you do take both at the same time, some people can get what's called serotonin syndrome, which is too much serotonin that causes different symptoms, dizziness, tremors, sweating, things like that. So that's something to watch for.
Okay. Are there any drug contraindications?
Yeah, anyone on antidepressants, check with your doctor first because that is a caution. Or if you're on any migraine medication, it's good to check with your doctor as well.
What are the useful cofactors with 5-HTP?
Yeah, B6 is the most important cofactor. You need B6 to convert 5-HTP to serotonin. So what's recommended is taking a really good multivitamin and mineral. So, such as like we recommend Nutrition Care, the SF88 Plus is a good one if you want a recommendation. Yeah, just to get your B6 levels up.
Okay. Do you know what about the contraindications? When shouldn't you use 5-HTP?
Anyone who's pregnant or lactating, it's not recommended to have the 5-HTP. If you have Parkinson's or a scleroderma, because scleroderma is indicated. Usually if someone's got a scleroderma, there's a problem with their tryptophan metabolism, so it's best to avoid 5-HTP then as well.
Terrific. Okay. Thanks.